So this is the second lecture. It's actually a third lecture, but I have this is muscles, and I have the shoulder muscles look at the shoulder girdle and the so the shoulder scapulothoracic joint and the glenohumeral joint. But what I wanted to point out first was the muscles. This is a small section. So look at this first for the individual muscles, and it just looks at like attachment points and details, and then it will show itself again. So look at this one first for the muscles, and then go back and look at it as integrated when we look at muscles as groups. Because I think when I did this lecture originally, I had muscles as part of it, but you kind of have to know the individual muscles first before you understand how they're grouped together. But with the shoulder girdle, because there's so much complexity going on between glenohumeral joint, scapulothoracic joint, that it's better to kind of have a preview of the muscles first and then look at the muscles as an integrated aspect. So the primary muscle, the third largest muscle in the body, is the trapezius. And the trapezius has three divisions. There's an upper trap, a middle trap, and lower trap. And they all have different neurological innervations. So this muscle is not all or none. Just like with the deltoid or with the pec, upper pec, lower pec, anterior deltoid, middle deltoid, these muscles can either be the divisions of the muscle. You can almost look at each of these muscles as three individual muscles because they can either be agonists or synergists working together, or they can be antagonists where they're working against each other, and depending upon what they're doing. But you have this global attachment down from the base of the skull, from the occipital into the nuchal ligament, all the way down into the entire thoracic spine. And then it comes up and it inserts all the way on the spine of the scapula onto the clavicle. So it is a massive kite, right, if you look at both divisions. And it has multiple functions. But we remember the trap from its influence on the cervical spine here. We said that it does contralateral rotation. So when this upper trap contracts, it's pulling the occipital ridge, and so the head's turning to the left. But it does have, outside of the head, the torso is usually the more stable component. It exerts most of its influence on scapular movements, particularly with retraction, upward rotation, downward rotation, elevation, and depression. So these are all movements that one will act as an agonist, one will act as an antagonist. The one movement where they all act as an agonist is in scapular retraction, when you try to pinch your shoulder blades back together, and probably upward rotation. But here are your three. Some textbooks look at the cervical region. There's two subdivisions of the upper trap, but for our purposes, we'll look at it as just one upper trap. Here's your middle trap, and here's your lower trap. Here you can kind of see the divisions then working out. And again, most of the attachment is on the spine of the scapula. It does reach around a little bit in the acromion of the clavicle. But the one thing to note is that it's all on the superior end of the spine of the scapula. So right here, this blue line, this represents the insertion of the trap. And you can see even lower trap, it doesn't come up and attach underside. It comes up and kind of floats back over. So if we go back around, you can see the fibers are kind of coming up and around. I tilted the image here a little bit so you can see, and you can see that it is a superior attachment right on top. So here's your scapula. There are the different regions here, the spine. You can see that. And then my next image shows the muscle imposed there. You can see that the trap's coming up, and it's coming up and around on top there. This is just fragments of muscle fibers that are coming here, but it does come up and hit on the aspect. So here's your upper trap, middle trap, lower trap. And when all three are contracting, you're going to get scapular retraction. So when you're doing a row or sitting there, or if someone puts their hand on your back and you try to squeeze your shoulder blades together, all three divisions are going to come in and work synergistically as agonists to produce that movement. If we change now our movement and we do more of a shrug, you can see that the upper trap is going to work as an agonist, and the upper fibers, you can see that the fibers are running horizontally, so you can have multiple divisions here. The upper fibers of middle trap will also come into play, but the upper trap is the primary aspect for scapular elevation, so when you're shrugging your shoulder. If we're looking at scapular depression, you can see that the opposite. The lower trap is going to be working as an agonist, the lower fibers of middle trap, and then the upper fibers are going to be completely off. So you get this type of component. And then, of course, with upward rotation, when your the scapula is trying to tilt up, I don't think I have that depicted here, but when the scapula is trying to rotate up, all three divisions, just like with retraction, are working as agonists to bring that this glenoid fossa, pointing it up to the sky with any kind of humeral elevation, with your arm up over your head and so forth. So next muscle is a serratus anterior, and you can see that this is a weird attachment point here. Let me see, I get it better. The serratus actually starts here on the medial border and then shoots all the way underneath the scapula around the front of the rib cage. So that's what you're seeing here, is that's the medial border towards the spine, and it flattens all the way out. So it actually acts as a kind of a foundation for when the scapula at the scapulothoracic joint. So here you can kind of see the muscles there, and what it does is it takes the scapula and moves it forward. So it's the exact opposite movement for protraction, which is the exact opposite movement of retraction. So bringing your shoulders forward, so rounding your shoulders out, is all serratus anterior. So the trap and the serratus anterior are working as antagonists in protraction retraction, but as we saw, or what we'll see, is with upward rotation, that all three divisions of trap and serratus anterior are all working together as synergists to get the arm up over the head. Here you have your rhomboids, and these are retractors, so they're going to pull the scapula back. And then what they're also going to do is when they contract, you can see they kind of have like an oblique line here, a diagonal pull. They're going to pull the inferior end up, and the glenoid fossa is going to point down, so they do downward rotation. So these are some of your strongest muscles for downward rotation of the scapula. They work with levator scapula to do that, which I think is the next muscle. Yeah. So we learned about levator before as a ipsilateral trunk neck rotator. So if trap contracts on this right side, it's going to turn the head to the left. If levator contracts on the side, it's going to turn the head to the right. But when we look at levator, we look at its influence on the superior angle. So when you shrug your shoulders, it's going to work with trap to do scapular elevation. But when it's working by itself, when your arm's coming down or back behind you, this is working with the rhomboids to do upward rotation. So like right here, this pulls up and this pulls in, and you're doing, I'm sorry, I said upward, downward rotation. In the front, you have pectoralis minor, so you have your coracoid process right here, and this comes down and attaches. It doesn't really have any function related to pec major. It's just pec minor just because of location. But it will, if you think of it as like a sling, like if you had let's say you had a sack and a single rope that's holding that sack, and you had it over your shoulder, and if you pulled down on that rope that's coming over your shoulder, that sack would go up. That's how the pec minor kind of works with the scapula. When that contracts, it pulls the scapula up and over, so it's involved in a little bit in protraction, definitely in downward rotation. Here's a muscle you probably never heard of before. It's called the subclavius. It's a tiny little muscle that attaches onto the first rib and attaches underneath the clavicle, and it helps with rotation of the clavicle during upward rotation of the scapula. Like a stabilizing component, and you can kind of see right there. So that's our scapular muscles. We're going to go on to our deltoid. This here, we look at humeral elevation. We'll revisit this slide, but it kind of talks about the complexity of when you initiate the arm over your head, how the deltoid is the primary muscle for that, but it needs to be initiated by supraspinatus if you're coming out to the side, or long head of the bicep, or cocobrachialis if you're coming forward. But put that on hold. That's more of a complex movement when we'll look at in the next muscle lecture here. But your deltoid has, it has, just like the trap, it's a complex muscle. It has 3 unique divisions, and it actually has up to 6 different innervations. So you have posterior deltoid, middle deltoid, anterior deltoid, and then you have 2 divisions of each. So you'll have like an anterior and posterior division of anterior deltoid, and a anterior posterior. So you have these different, or medial lateral aspect. But don't worry about the complexity of that. I just want you to know how fine-tuning the deltoid has. But what you can see here is that the deltoid has different functions. It has abduction, like we think it does. It has flexion aspect. It has extension, horizontal adduction, horizontal abduction, and has some ability to do internal-external rotation. So it does a lot. Depending upon what motion you're doing, the deltoid, all 3 heads can be working together as agonists synergistically, or depending upon what you're doing, they can be working as antagonists with each other. So you got to make sure you're clear on what division the deltoid you're referring to. So if you look at the top, you can see that the fibers run from this view laterally, right, from lateral to medial, or from distal to proximal. So you have a posterior division, you have a middle division, anterior division. You can see that better here, posterior, middle, or lateral. and anterior. So if we're looking at the side here and we look at, here's your front, here's your back, so it's a lateral view, here's anterior division, middle division, posterior division. In abduction, in the frontal plane, all three heads are going to be working synergistically to get the same job done. I believe this is the only time that all three heads are working together. If we look at sagittal plane motion and we look at, like, let's say humeral flexion, anterior deltoid is definitely going to be on. And you can see that the middle deltoid, its fibers, here's your axis of rotation, the anterior half of middle fibers would be involved in flexion. So people usually just think it's, anterior deltoid for front raises and posterior deltoid for back or rear raises or tricep pull down, and that when you do lateral raise, it's only middle deltoid. That's not true. When you're doing lateral raises, you are using middle deltoid. That part is true, but anterior deltoid and posterior deltoid are coming on as hard as they would during flexion or extension. So then the opposite of this is true, the inverse, when we look at extension. And if you notice here, I have flexion and horizontal adduction. This doesn't matter. When you look at the muscular responsibility for flexion and horizontal adduction, they're very similar. So pec major and anterior deltoid, biceps. The only thing that might differ is the initiation of that, but the primary movers are the same. The same thing for extension and horizontal abduction. You're going to be looking at like posterior deltoid, teres major, latissimus dorsi, triceps long head, and so forth. But in this case, we're looking at the posterior deltoid 100% all the way, and the posterior half of the back half of middle deltoid. So here you can see how all three heads are going to be working for lateral raise, for adduction. I'm sorry, I said adduction, but I meant to say abduction. Here you can see the anterior deltoid and the anterior half of middle deltoid for horizontal adduction. So same as flexion, just showing it from this perspective. And then same thing there for deltoid. So deltoid, very complex, lots going on there. Anytime the humerus moves, the deltoid is involved. It is impossible to move the humerus and not involve some division of the deltoid. We'll talk more about training considerations later, but this is why a lot of deltoid or shoulder work is redundant, because if you're doing any kind of pushing or pulling activities with the upper extremity, you've already involved your deltoid. So the most popular muscle to train on Mondays is pectoralis major. You can see that it has three divisions. It has a sternal division, clavicular division, sternal division, and a lower division, sometimes looked at as rib cage. There is no such thing as inner pec and outer pec, because you can't contract these fibers, and you can't contract half the fiber, but there are upper and lower because of the horizontal nature of that. But the bulk of the muscle attaches on the sternum and lays in the rib cage, and then all converges. You can see better in this picture here, all converges down into a single attachment here on the humerus, right on that intertubercle ridge crest. Powerful adductor, horizontal adductor, and shoulder flexor. Its antithesis, second largest muscle behind the glute, the latissimus dorsi. You can see that it has an extensive attachment into the spine and into the pelvis. It doesn't really attach there directly. It attaches into this thing called the thoracolumbar fascia, but it does influence thoracic extension, pelvic mobility, hip hiking. It's a massive muscle, and it does a lot. It comes up here and wraps around and attaches the anterior side of the humerus, and it for the arm, it's going to do adduction, so adduction. It's going to do horizontal abduction. So that's one thing to note here, is that the pec does horizontal adduction, and the lat does horizontal abduction, but in the frontal plane, it is a vertical adductor, right? So vertical adduction and horizontal abduction, different movements, but same muscular participation. And it's easy to get the tricked up where you would say, it's an adductor all the time, so it does horizontal adduction and frontal plane adduction, and that's wrong. It's different. Horizontal abduction and horizontal adduction are different than frontal plane adduction and abduction. It's better and easier to remember horizontal adduction as flexion and horizontal abduction as extension. It makes more sense because it's the similar muscular participation. You have another muscle here that's called teres major. It should really be called latissimus minor. So unlike pec minor, which had no relation to pec major, teres major is essentially a mini latissimus dorsi without its attachment to the spine and to the pelvis. So it does everything the lat does at the humerus. It just doesn't do what the lat does at the pelvis or the lumbar spine, which most people don't even think that the latissimus, most people don't even consider latissimus dorsi as a influencer of the spine or the pelvis. So and for the general population, teres major and latissimus dorsi are the same muscle. It really should be called latissimus minor. If I had control of the world, there's a lot that I would do, but that's one thing I would change. So you can kind of see teres major attaches to the lower end. And even so, like if you look at the latissimus dorsi here, on some people, there is a little bit of a fascial connection there at the inferior angle. So latissimus dorsi touches there, and right where it touches, that's teres major, and then just continues on. It's almost like teres major is the scapular attachment for latissimus dorsi. That's how I envision that. There's a teres minor, which is part of the rotator cuff, which is in a similar location. You can see that right here, but it's different in attachment, in function. So then what's left are the rotator cuff muscles, and there's 4 of them. You have supraspinatus, infraspinatus, teres minor on the posterior side, and then you have subscapularis on the anterior side. So you have supraspinatus. It can do external rotation, and it's a weak external rotation. So if you ever see it on a test question, and if it doesn't make sense, it is an external rotator. But if you see it and it's asking which of these muscles is not an external rotator or something to that effect, it's not a wrong answer. It's just that the supraspinatus's primary function is actually abduction, so lifting the arm to the side, and that's usually reserved for the deltoid. But the supraspinatus initiates abduction. That's what the primary aspect of it is this abduction. I think I have a slide here that shows. So what happens when the deltoid contracts, that the way the deltoid attachment, it's right here. There's very little leverage. So actually when the deltoid contracts, instead of lifting your arm to the side, it actually jams it up. It lifts it straight up towards your ear like a shrug. And what the supraspinatus does is it engages a little bit. It just gives it like 5 degrees so that the deltoid can actually then do its job instead of pulling up on it. You know, think about if you had you had a rope over a cliff, and it was like a sheer cliff, like a building, and you wanted to get that out to the side, and let's say you had it like on a rope, that would come straight up first. And if you tilted it out a little bit, then you would be able to exert your force perpendicularly and get that up to come out to the side. That's really that's the primary function of that supraspinatus, is to initiate that abduction. So it is a primary abductor. That's how it's going to be listed, but it can do external rotation. Just keep that in mind, that it's going to always be an abductor, but it can do a little bit of external rotation. Your 2 big external rotators are going to be infraspinatus, that's right here, right, and it fills in that entire fossa that we were talking about, and attaches on that greater tubercle, so it's perfectly aligned for external rotation. And then right below that is teres minor. So those are your 2 external shoulder rotators, is teres minor and infraspinatus. And then what's left is subscapularis, and that's on the entire fossa of the anterior surface of the scapula, and that does internal rotation. So you can see all the muscles here linked. You see teres minor, infraspinatus, supraspinatus, and subscap, and you can see that they make a cuff around the shoulder, and that they really, if they all contract at the same time, they're actually stabilizing the shoulder and compressing the heck out of that head of the humerus, making sure it's maintaining a nice congruent fit into that fossa. This is a really nice depiction of looking at, here's your right arm superior view. There's the glenoid fossa there. There's the head of the humerus, greater tubercle, lesser tubercle, and you can see all the muscles that are involved in internal rotation. So latissimus dorsi, pec major, and the 2 little itty bitty muscles that are teres minor and infraspinatus. And notice that you do not have supraspinatus listed here, because it does do external rotation, but it's more in pull for abduction. One other shoulder muscle that is a shoulder muscle is the coracobrachialis, and it attaches here on the coracoid process here, and it does shoulder flexion, a little bit of horizontal adduction, but shoulder flexion is the function here. And again, it initiates the arm forward a little bit so that it can you can raise it up into humeral elevation. And then biceps brachii. It actually has zero attachment to the humerus, and we consider this an upper arm muscle, but all of its attachment, it converges down into the same attachment past the elbow into the bicep tendon tuberosity of the radius. But you can see the two tendons here. You have the long head and the short head, and the long head attaches in the glenoid fossa, so right above where the shoulder attaches, and it acts as almost like a stirrup or a sling to keep the head of the humerus stabilized, and it goes right down that groove. And then you have coracobrachialis, which attaches to the coracoid process, and the two come down. So they actually their tendons act as shoulder stabilizers and are very much involved in shoulder flexion. So it is just as much a shoulder flexor as it is an elbow flexor. And then triceps a little different. It has three heads. All three converge down and attach into the olecranon arm process and involved in elbow extension. But it has the long head, which is the bigger of the three divisions. It originates just below the glenoid fossa. So you have biceps that's coming on top on superior glenoid fossa, and then you have long head triceps on the inferior glenoid fossa. So the head of the humerus is stabilized by both the bicep and the larger portion of the tricep. And it does do, not only does it do elbow extension, but it does shoulder extension as well. So it's if you're doing like a seated row, you're working long head tricep. You can see that tension there, that infraglenoid tubercle, so the inferior part of the glenoid, and then right there, right where the pointer's at, that's where the biceps would be. And then just a clarification, where the humerus goes, the scapula goes, and the scapula doesn't really do like upward rotation or shrugging. The scapula is following the contour of the rib cage, so it's going up and over or down and back. And so when we start looking at these humeral combo motions of the scapulothoracic and glenohumeral joint, when you're doing any kind of shoulder flexion, abduction, internal rotation, you're always getting some concomitant movement of scapular, either protraction, up rotation, elevation, or all of the above. And the opposite is true for the down and back. And this is what we're going to go into in the next muscle lecture, looking at the movements that are occurring and the muscle participations for this whole complexity. There's much more complex movement of the upper extremity there is in the lower extremity outside of the foot. And that's why we did the individual muscles first to give you a little of exposure to it, and then go and listen to the other lecture for the combo movements. So just make sure you're reviewing the muscles on either of those pages, and it should be pretty good.